Hi, my name is Mokhtar Akbari, physiotherapist at Rito Physiotherapy, and welcome to part 2 of your guide on online or virtual physiotherapy treatment. In this part today, we'll be talking about the types of conditions that can be most easily treated through an online physiotherapy treatment session. So let's jump right into it. To understand what and what cannot be treated through an online physio session, we need to understand the tools that physiotherapists use. So basically, most conditions can be treated well through an online physiotherapy treatment, and the reason is that a lot of the tools that physiotherapists use are translatable to an online type of service. So for instance, in the assessment, we have several parts of the assessment. One is the history of the patient. So that's where you're telling us how your injury occurred, how the pain began, and the information related to that. That can be done online very easily. The second part is observation. So we're looking at what parts of your body are able to move, in which ways are they able to move correctly, or are they not moving correctly, what is normal in your movement and what is abnormal. That can also be done through an online physiotherapy session if you're able to stand far enough from the camera so the physiotherapist can visualize the area correctly. Now, what can be done through an online session is the hands-on part. So there are special tests and palpation things that the physiotherapist needs to do, palpating certain areas, holding certain areas, touching certain areas that the physiotherapist cannot do through an online session. And that's the part that can't be translated through an online physiotherapy session. But basically, most of the parts of the assessment can be translated and done through an online session. So that means that a lot of the assessment is virtually the same, whether you do it through an online physiotherapy session or whether you're at the clinic. The other tools that we use are tools that are geared towards the treatment. So a lot of our treatment will be, first of all, education. So once we understand what kind of problem you're suffering from, we'll be educating you on what to do to avoid causing the pain or aggravating it further. Second is therapeutic exercises, so exercises geared towards actually reducing your pain or stretching a certain area or strengthening a certain area. Both of these things, all of these things can be done through an online physiotherapy session. It doesn't require you to be there with the physiotherapist. Then there are mobilization and massage techniques. This part cannot be done online. But there are some aspects of massage, some simple aspects of massage after a surgery, for instance, or for specific types of injuries, simple aspects that can be taught to a patient or the spouse of a patient to be done. They can be taught online, and then the person or themselves or their spouse or a family member can do it for them. Then there's medical devices that physiotherapists use, such as ultrasounds or TENS machines. So some of these can be ordered for the patient through an online service, and then the person can receive the machine at home and be taught how to use them by the physiotherapist. To be honest, I don't use many medical devices or machines in my practice. Most of my treatments rely on exercise prescription and also understanding what is causing the disease and removing the causes of the disease to promote the body's ability to heal. And I do some hands-on treatment as well when I'm seeing people in the clinic. But for now, for the online physiotherapy, most of my treatments are education and therapeutic exercises that are helpful to reduce pain and get the person back on track. So as you can see, a lot of the physiotherapy tools can be easily translated to an online setting. So that's why most conditions can actually be treated really well through an online physiotherapy treatment. There are some conditions that I can think of that are most easily treated. So for instance, low back pain, neck pain, depending on the type and severity, shoulder pain, knee problems, arthritis. A lot of these can be helped greatly through exercises, and these are conditions that I treat through online physiotherapy treatment. As well, people who have had injuries in sports, for instance, if there's sprains or fractures, once they get out of their cast, the surgeon says they're allowed to start to rehab. A lot of the treatment for that will rely on exercises, and that's very readily done through an online physiotherapy treatment session. As well, there's post-op. Yeah, so people that have had surgeries hip replacements, knee replacements. A lot of that, again, is exercise-based physiotherapy, so that can be done very well online. So what I'm doing at my clinic is, once you book an online session with me, I'm offering the assessment, and after the assessment, I'll be telling you basically whether you're a patient who I deem to be in category A, category B, or in category C. And what those are is that if you're in category A, that means I think that almost all of your physiotherapy treatment can be relatively done online, and I expect that you'll fully recover through an online physiotherapy treatment. Category B means that you have a condition that I expect will get mostly better, so maybe 80 or 90% better through the services that I can offer to you online. But you might need to see myself or a clinic or go to a clinic that's local or closer to you when it is possible, in order to get that extra 20% or 10% to get fully recovered. And then category C is patients that I assess and I deem that they cannot benefit or won't get much benefit at all from online physiotherapy, either because their condition is too complex to be assessed through online physiotherapy, and I can't get a handle on what the diagnosis is, or the second part is the treatment really requires hands-on treatment and deeper hands-on treatment and massage, which they cannot get through an online service. But for the most part, people are in category A or B, meaning that they will get at least some benefit from online treatment. If after the assessment I deem that the person is in category C, basically what I'll do is I will not charge them for the initial consultation. So that's it for today. I hope this was helpful. And that it'll help you understand what kind of things can be treated easily through an online physio session. You can book online with me by going to my website. In the next video, I'll be talking a bit more about experiences that I've had with online physiotherapy and how patients have done. Okay, see you next time.